All right, awesome. Good morning, everybody. So let me go ahead and am you able to see my the slides? Okay, perfect. So welcome to the MMIS or Medicaid Management Information Training for CPOP and for our new community partners. Some of you that are on the call may have used MMIS in the past or have used it in other roles within your positions, but we're going to be talking about the new limited access MMIS program that's become available to all of our OHP assisters. Hey, Daryl. Okay. So for agenda today, so we're going to do just a little bit of a program overview. We're going to go over HIPAA rules around MMIS. We're going to provide an MMIS walkthrough. We're going to try and spend some time going through troubleshooting and common issues and concerns, and then have an opportunity to do a Q&A or questions at the end of the training as well. So as I mentioned earlier, so we're going to be doing just an overview of the limited access MMIS program. So this is a program that CPOP and our provider services that manage and run MMIS within our internally within OHA. Worked really hard to design a program specifically for our sisters, ones that weren't able to necessarily access MMIS through their normal routes, which will oftentimes be through a provider's office, a clinic, because it's oftentimes used by our clinical services to verify whether someone has active OHP benefits or what other private health insurance they might have along with, or Medicare along with their OHP as well. The types of things then, and for folks that probably have used it or looked up and attempted to use it since they've gained access, will realize that there are, it is limited information, but there are some really helpful pieces within MMIS that you guys don't have access to within the One Applicant portal and some of our other systems. Like I know there's SIM3 for folks that are in my area that you may or may not have access to. So this is really helpful to have MMIS. So we'll be able to identify and see whether you have OHP benefits, whether it's active or whether those benefits have closed. You'll be able to see whether the person has any other health insurance. So that's going to be Medicare enrollments, or as well as what we say third-party liability, which is oftentimes going to be a private health insurance plan through someone's work. Their OHP client ID, which is their OHP medical ID number, renewal dates, CCO enrollments, OHP benefit level. So sometimes folks don't have complete OHP, they might only have mental health services, or CCOF might only have dental services, as well as if they happen to have hospital presumptive eligibility. Anything else, Christina, to add there?
Sorry, only that because this is like a limited access view. So like some of you who maybe already have existing access to MMIS because maybe you work for a provider's office and you're able to do like billing and prior authorizations, this particular limited access view doesn't allow to do any of that. So so unfortunately, any questions related to like the billing process for things or like how to submit a claim are outside of the scope of this training, just because it doesn't this particular access doesn't allow you to do that within the system. But we are going to share at the end of the training some tools that are available for you that you can check out. So you can, there are through our provider services unit.
Perfect. I think that, yeah, that's really good to recognize that it really is a view only, which is honestly a lot of the systems that CPOP has access to is view only, because we don't have those trainings as well. So that's way it gets you the information, but that way we can't tinker with things we don't understand, which is like always good for me. All right, so let's go a little bit over privacy and security. Whenever we as our community partners and us as state staff gain access to new systems, especially systems that we're going to be gaining access to people's personal identifiable information or information that falls under HIPAA. It's just good to do a high-level overview of things that we want to keep in mind, as well as most importantly is we have a couple resources as well as a state training that you guys will have access to as well in case you have any other further concerns or questions around HIPAA today, because we're going to keep it high level. So privacy and security for community partners. privacy and security, as we know, is a right for the community members and the partners that we work with, and a right to have a protection to that privacy. And OHA, Oregon Health Authority, is committed to protecting the personal and confidential information of clients and employees. Our clients' employees expect the Department of to protect personal information, just as you expect your information to be protected by financial institutions, healthcare providers, and others. And this commitment is imparted to our community partners as well, and any of our external partners. Whenever you guys are working with someone's information, we want to make sure their information is being stored securely, and that we're limiting the amount of information that we're asking for in order to do the work that we're doing. So HIPAA, just as an overview, is our Health Insurance Portability and Accountability Act, United States legislation that provides data privacy and security provisions for sharing and safeguarding medical information. There is a long list of policies and guidelines and expectations on how information is collected and stored. As I mentioned, we're not going to go into those depths, but the types of entities that HIPAA does cover is going to be healthcare providers, health plans, healthcare clearinghouses, as well as business associates, so other organizations and external partners we work with, which would in extension be your community partner organizations. We just have the OR number that talks about covered entities and purposes for HIPAA for folks that want to learn a little bit more, as well as some of the policies around where kind of our community partners fall under kind of contractors. But the biggest thing that I want us to really take away is that if you do, and this is always a good time for us to kind of evaluate or reevaluate, if you have any concerns about how information is being stored or you need support with that, let us know. We always want to make sure that we're storing information securely, and that we're going with the policy here is the takeaway message at MMIS is what we call minimum necessary. So community partners should only be accessing information in MMIS, and that goes for any of the systems that we've access to, when there is only a legitimate reason to do so. So we won't be looking up family members or any other information unless it's part of the purview of our positions or our jobs. MMIS, it does not function like the one. You will have the ability to look up anyone's information that is in MMIS, but you should only be accessing information when it is necessary and when you've been requested by a community member. Okay, so. Maria, I saw you sent me the message about no health plan information. We'll cover that. I apologize if I missed it. So it does let you know about the CCO level that the person has, but it won't always tell you about like the provider or the health plan they're in for those that are in like health share area. Sorry, that was a message sent to me, Christina. Okay, and then just as for supports for you guys, we have a list of resources for community partners. So you all do have access to the workday learning that us as state employees take on a regular basis. So it's part of our extended learning opportunities. So there's a link there. And then the browsing keywords to look for is the ISPO 2022. To get access to our privacy and security trainings, as well as there's some links there if folks have any questions or concerns about that past kind of the high level we're going to go over today. Any questions at all before we kind of dive in? We kind of wanted to preface a little bit ahead of time of kind of the angle and approach we have with this program. It took us a very, very long time to get general CP and its sisters access, and I think there were concerns around privacy and things like that as well. So we just want to make sure that we are being good stewards of information and of people's information and care as well. So I will go ahead and pass things off to Christina that'll be doing our MMIS walkthrough. And Christina, just let me know when you want me to hop through slides and I'll jump through.
Okay, thank you. So I don't think I fully introduced myself earlier, but I'm Christina Hernandez. I am the Regional Outreach Coordinator for the Willamette Valley. And then up until probably last week, I was also the Regional Outreach Coordinator for Southern Oregon, but transitioning out of that role. And then also joining us today in the background, helping us with questions is Kelsey Statham. She's the Regional Outreach Coordinator for the Southern Coast. And then we can go ahead and move on to the next slide. So I think this is probably going to be one of your favorite. favorite websites that you're going to be accessing probably all of the time as you're doing Oregon Health Plan applications. And it's or-medicaid.gov. So www.or-medicaid.gov. This is our Medicaid management information system. So again, this is a database that shows all of our Medicaid members in the state, and you can look at eligibility. And then we're going to see some examples of this, what the screens look like, as far as like what kind of information you'll be able to access. And then we'll also touch a little bit on how to read, because some of it is like written in, there's like little codes. So we'll explain what some of those codes mean as well. And then probably after the training, we will also send out a like a one-page document that has really, really tiny stuff, but it also has basically a summary of all of the information that we're going to be talking about today. But one of the key things, again, so this is going to be, I would star this website, or put it in your favorites in your browser. But once you click here, click on where it says providers login. And I think this is actually something really important, because most of the you here don't work necessarily for healthcare provider organizations, and so you might be thinking of providers as just a healthcare provider, but in this sense, we are referring to all of our community partners as a provider, because you are providing a service of like Medicaid enrollment and navigating the healthcare system for folks. So we are considering you providers in that sense. So you would click on that login link, and then it would take you to the next screen. So if we can move on. Then this is, so most of you, I think, are here because you've already created your account. You've already received your access to MMIS. Some of you, I think, it might still be waiting for that. But once you've gotten all of that set up, you would just, this is what you would see for your login screen. So you just enter your username, password, and log in. And then we go on to the next screen. So some of the really key things that you'll need to be able to find information about a member are, so you're going to need at least minimum 3 types of identifiers. And so most likely that's going to be their last name, first name, and their date of birth. If you happen to know their client ID number, maybe they had OHP in the past and they're just not sure whether that benefit is active or not, you can enter their client ID as well, or their social security number. So again, you do need a minimum of, this is just a list of different combinations of identifiers that you can use to find that person, but you're going to need a minimum of 3. Otherwise, if you don't have enough, it's going to tell you, it's going to give you this little error message that says, not found, client not found. The other thing that you'll need to enter into this screen is on the date. So you see something that says from DOS to DOS, and DOS stands for date of service. And so basically the system allows you to look at somebody's benefits for the past 13 months. So, or for during a 13-month window. So in our example, you could say we were helping a client that on the 21st of June, and we wanted to see what their benefit level was for the previous 13 months. Then we would just enter that information on there. And then when it does say client ID, like that's just one of the terms that we use to refer to somebody's OHP member ID. So it might be their prime number, their OHP member ID, or client ID. That's all you phrases that we use to describe somebody's Oregon Health Plan ID number.
And we did have one question from Teresa. Just asking, do you receive an error message if you've entered too much information, or is there communication?
No, only the only times that I've seen error messages is if there's not necessarily an error message, but if it's not found, it'll say subscriber not found. So and we're going to talk a little bit about yeah, so I think that one, but usually it's when you don't provide enough information to try to run a search queue is when you get the error.
Thanks.
Yeah, the other thing is, like, I think especially because as we're working, oh, Kelsey says yes. So the other thing is that I think because a lot of our systems aren't necessarily set up to meet all of the cultural needs of our community, I think this is something that's really important for us to remember, is that if you're working with clients that might have like more than one last name. So for example, my name is Hernandez Plasencia, and it's hyphenated. MMIS doesn't actually use special characters, so it doesn't take hyphens. And so if you can't find somebody, like maybe you typed in, Cristina Hernandez Plasencia, and then it didn't find them, sometimes you have to play around with different combinations of the last name. So you might have to search for, as for in this example, we said Lopez Perez. So Lopez Perez with a space between, or sometimes it's Lopez Perez all together, or maybe just Perez or just Lopez. So if you're not quite sure and you're like, hey, I'm pretty, because I know that sometimes that used to happen to me where I was working with somebody and I knew they had OHP because I had helped them apply and I knew their benefits were active, but I was trying to find something like maybe which CCO they were enrolled in. And then I couldn't find them in MMIS. And it was because for some reason, the way that the name got exported from the one system to MMIS didn't completely match, and so I had to play around with different combinations of the name. So this is also true if somebody has like a first name that's maybe more than one name. So maybe somebody whose name is Julio Cesar, where that's all together. So play around with the different combinations of the names because that might help you find that person. But I think one of the really important things is that if you happen to have somebody's social security number, that's usually one of the best identifiers that you can use to try to pull up a client.
I was going to say that, or their OHP ID as well.
Or their
You know,
OHP ID number.
anything that's like super definitive that it's connected to that one person. Because Christina, it has to be like you have when you're looking up a name, it has to be like identical to the way this system has it, correct? It's like, can you put in like a partial name and still pull them up, or does it have to
No,
be
it has to have a full name. Yeah. And then I see that there was a question from somebody saying that I noticed that the DOS won't run past today's date. And that's actually a really good point. So if we go on to the next slide, I think it'll show us an example of Holly's question. So in the DOS, it'll only show as of today because it won't show a date of service in the future. So it'll really just show us from today. So we can go from today and then 13 months in the past. Yeah, and then is there any other questions for that one?
Yeah, but I agree. So and because you can look how far back into the past can you look? Is it like
so
years?
yeah, so it's funny because I actually didn't back when I was an assistant, I actually had this type of access, before I worked at CPA. So I didn't realize that you could. So I thought it was just 13 months in the past, but actually it's just a 13-month window. So it could have been like maybe I'm curious to see if somebody had benefits for whatever reason, like maybe I'm helping them with I don't know. Can't think of a scenario, but maybe they were curious about in 2020, did they have benefits in 2020? And we know that that's past our 13-month window, or like our, 13 months from today. So you could actually go back and find a date in 2020, as long as the search, like the dates that are between the DOS and the from DOS and the to DOS are a 13-month window. You should be able to see if somebody had benefits at that time and what type of benefit they had at that time.
Perfect. Thank you.
Yeah. So this is just an example of what that looks like filled out again. So you would enter the client ID number, their last name, the first name, the date of birth, and then usually with those three things, like to me, I think for me, what was the easiest was the last name, first name, date of birth, and it would find the person. But again, if you're struggling to find the person and you happen to know client ID, you can put that in there. Or if you have the social, even better, because then if it finds them pretty quickly. And then the DOS, and then you would click on where it says search. And then we would go to the next screen. So then what you will see is something that displays like this. So I sorry, just a question that comes up, and I'll try to answer that in a second. But you'll see something that looks like this. So it'll show you, like, obviously for privacy reasons, we had to blank this out over here, but it would show you the person's first and last name, their client ID, and their date of birth. Something else that's also really helpful from this screen is that if the person had, so in that section, that top section that says client information, if somebody received their OHP benefits because maybe they were in the hospital and they have hospital presumptive eligibility, it would say yes in that area. And I think that's super helpful because you would know that, the hospital presumptive eligibility is only good for 60 days. And so then you would know if you're working with that person, oh, okay, we actually need to fill out a whole new application for them. Something that you'll be able to see with this limited assister view, and I think this maybe goes back to Holly's question, is that you'll be able to see the renewal date. So a future renewal date. On there, and then it also shows you if you have If the client is known to the system to have like Medicare, it'll let you know when that Medicare Part A, B, and D started. The other thing that you'll see is it tells you when their last dental visit was. And then next to in that right-hand side, it says branch ID. So that lets you know which local, like maybe ODHS branch is assigned to that case. And then also it'll list the phone number for that case. So I think that's really helpful. Like if you're trying to, maybe you're working with an eligibility worker or there's something like specific to that case where you want to talk to somebody from that branch directly, you could call that number. And I think that's especially helpful if you're working with folks that are maybe receiving services through like aging and people with disabilities, and maybe you need to contact their caseworker through aging and people with disabilities. So that's a good phone number to have. So again, I think I already covered these things. And then I do want to pause for a second for questions because I think I saw Daryl had a question and then somebody else had a question.
Yes, I want to go back to the hospital preventive present. I got mumble brain.
No worries.
The eligibility. So that says it shows. You said if it shows yes, that means they have. So if I'm working with a person and they have that, so the hospital get them temporary OHP, and then but they have not filled out a whole application.
Correct.
Is that what I'm reading when I see that? And
Yeah.
Okay, I need to go in and do a whole application with them. If it says no, that means they don't need to do all that, right?
No, correct. It means that yeah.
Okay, I just want to make sure I got clear on that one. Thank you.
That's a really good question, because it's amazing how just these simple little things can mean other things that you have to do. So if you see that yes, okay, we have to do the whole application. It's just like I'm glad you asked.
Yeah.
Okay. Do you want me to and do you want to answer the one from Kelsey, or do you want to move on to the next slide?
Sorry, I lost the question box. So
Kelsey asks if it's a client that you're assigned to and are attached to in the one system, you can see this type of information in the notices mailed to the client.
Oh, I think she was replying to Holly's question.
Oh, sorry, Kelsey. Okay.
Thank you.
You go ahead and move us forward.
All right. So the other thing, so I think this is probably the one when I was an assistant and I didn't know what was on the screen, like when I first started my job or when I first had access to MMIS. This is one of the ones where I was like, what do these little codes mean? And so under the benefit plan type, it's going to show you, so this on the screen, you'll see a list of all of the codes where if somebody were to have full OHP benefits, so they qualify for one of the programs where they OHP pays for their full, their medical, their dental, their behavioral health, all of that stuff. These are codes that that stand for that. So for example, BMD is for somebody who has, again, full Oregon Health Plan benefits, but maybe the OHP isn't covering the Medicare Part D drugs. The other one is the BMH, which is this is probably the most common one. So this is the one that you would see for somebody who's under 65. They're not Medicare eligible. They don't have one of the non-MAGI Medicaid programs. So if they're just MAGI, you'll most likely see this BMH coverage. And so that again just means that they have full Oregon Health Plan benefits. BMM is the same type of BMD coverage. So usually that means that person has Medicare benefits, plus they have a Medicare cost sharing plan associated as well. And then BMP is, again, full Oregon Health Plan benefits, but this is the benefit that pregnant individuals would get because it would signify that they have the added vision and dental benefits. And then we know that CalWAM has been phased out as of July 1st because of Healthier Oregon, but you might still see, so say maybe you were looking at historical coverage for somebody, you would see CWX, and that would mean that the person has the full Oregon Health Plan benefits and the pregnancy level coverage because they were an individual who's receiving the citizenship with medical. But again, you most likely won't, in the future, you won't see that plan type. You should only see it if you're seeing historical information for that person. And it does tell you the effective date. So if you see on the screen, it tells you the date that started, and then the date of the end date. I think something really important is that it'll show you an end date of today because it can't show you like it won't show you like the end of, so say I was looking up somebody's coverage today and it's October 2nd, it would only show me an end date of today because it only shows me what is active as of this moment right now. It wouldn't show me October 31st. Even if that person does have, you see on the renewal date that up above that, maybe we do know that they have active coverage in the future, but I think that's something really important because if you were to print out, like maybe somebody wanted to see a printout of this, you could print it out for them, and maybe they wanted to take it to the pharmacy. Sometimes the pharmacies, like if they wouldn't, if sometimes the pharmacies are a little bit like hesitant about like accepting that as proof of coverage because it shows the end date of, it shows it as ending today, even though it isn't, it's active. So I think that's just something to remind folks is that it's only showing, if you print it, it's only going to show you an end date as of the date that you printed it. And then, oh, I see Vixen has a question. I am not 100% sure for that one, Vixen, but I think we can find that question. We can answer we can ask our policy folks for that and get back to everybody.
It's a good question. There are definitely a lot of pieces that may not pertain to us all the time, but yeah, we'll definitely find that out.
Yeah. And the other one, so this is what you would see for other Medicare codes, but also for other benefit levels. So for example, we talked about the citizenship waived medical, it would show CWM. And again, this was phased out as of July 1st, but you might still see this like if you're looking for that historical data for somebody. DEN and DNT are the code that displays when somebody is getting dental only benefits. So that's, for example, the Veterans Dental Program or maybe the COFA Dental Program. And then MED is one of the codes that shows up for somebody who's getting maybe just help with their like Medicare cost sharing parts. So, and then I do want to pause because I think there were some questions coming in.
Just some follow-up from folks who are saying that the contracting nursing is probably for the home care services.
I just had a question real quick,
yes,
Sean. When it comes down to when you guys said print out, aren't we just view only? We're not able to print this information out. Am I correct? Because you said if you want to look, if somebody want to look at it and see, or so you can take to the pharmacist, is that something we can do, or does someone else have to do that as me? Because I just work for organization and I'm the sister within the organization. So
yeah, so you can still print it. What we mean by view only, it means that you wouldn't necessarily be able to update anything. Because so MMIS, like on our side of things, like for example, there's some teams within the state of Oregon who work on MMIS for like billing or they'll make updates to cases. There's some stuff that can happen within MMIS, and so those people have like a different type of access. So what we mean by view only is that you would only, like, you wouldn't be able to submit like a prior authorization for somebody or to like submit a claim for somebody through the system. It means that you only have access to be able to see the stuff, like see the information and whatever's displayed on here, like the screens that we just showed you, but you could print it.
okay. And also it should just go, and and maybe this is a silly question, silly comment, but this is only goes for the person who I'm working with. Like no one can contact me, because a few people I work with are at treatment centers. They have treatment centers, they have like a nurse and stuff like right there. So a nurse can say, hey, can you treat me out John Doe's information? John needs to give me permission and I need to give it to John for that, right? Other than having that, that paper we sign for him to be a part of, will be on my caseload. I should be more intentional, right? To make sure it's only going to John and not somebody else. Am I correct in saying that?
Yeah, you can work with that, and then unless they give you permission to share it with other folks, yes. But yeah, I mean, keeping those all of, we talked about like some of the HIPAA, like the privacy and security stuff. So yes, because it is protected health information that's viewable. So yes, treat it the same way that you would treat any other protected health information. You would also see, so it wasn't necessarily on this, but I did see that there was a comment, somebody asking about like QMB. So that is something else. Like, it's not on our sheet over here, but for the folks who have Medicare coverage and then they have some other type of Medicaid benefits, so like maybe they're getting one of the Medicare savings programs, you would see something that would say like the QMB or SMB or SMF. And I don't think that's in our little cheat sheet, but I think that's something that maybe we can still email out to everybody, that we do have like a couple of brochures that talk about the Medicare savings programs. And so it does have those acronyms in there, but those are viewable also in MMIS.
And Christina, that's the thing that NJ was asking, is MED, the Medicare cost sharing only, is that like a Medicare savings program, or is that something different, like a Medigap policy plan?
No, I think it is one of the Medicare savings programs.
Thank you, Jay. Good question. Sorry, you're getting a lot of questions thrown at you. So
I know. No worries. I know. I'm like, oh my goodness, what if I don't know any of these? But I actually do know most of these.
And that's a great thing for you guys to know too. I mean, some of us gained access to MMIS the same time as you guys did. So first thing, that's why I lean on Christina a little bit, because she got to use it in her job before I could. So we're all learning together. So I appreciate all the really, really great questions, because sometimes we might not know yet, but we'll get the answer for you.
And then, okay, so another really important part of this, like the eligibility screen that you'll see is where it says under the benefit plan. So there's actually another category that says service type, coverage, and copay. And so you could actually click on, you can click on any of those benefit plan types, and then it expands to show you this thing. So for example, in this scenario, the person had the BMM coverage, which was for, again, full OHP benefits for somebody that has Medicare cost sharing as well. And so, for this particular person, you see it says like QMB, so they have that qualified Medicare beneficiary, which is one of those Medicare savings programs. And so if you click on that, it tells you like, okay, so like medical care or chiropractic, like that's active, they have active coverage for that, or they have active coverage for hospital, inpatient, maternity, audiology. We asked about the limitations because I was like, Sean and I were like, well, what does it mean if something has limitations? And then they were like, oh, I think they give us this explanation where they're like, I'm not really sure. I think it's used on the back end for coding and billing part of things. But yeah, I don't know.
Yeah, I think they did follow up with me on that. And I think that we were right, Christina, that the limitations, we believe, covers like limited dental benefits versus full benefits. So like general adult dental benefits that may have more limitations than like a child benefit or
the pregnancy
individual.
Okay, that's what we thought. Okay,
good. Yeah, so it's more of a descriptor that a provider might use to see what level of coverage the person is eligible for. Yeah, exactly. Yeah, veterans dental would fall into the same category as kind of the general adult, so it would most likely say limitation as well. Awesome. Yeah, Kelsey agrees.
Okay, thank you. All right, and we can go to the next screen. Yeah, no, we can go ahead and move on to the next screen. So this is actually probably another really, really important part. So if you're working with somebody who has third-party coverage, this is where it would show up. So there's a section that says TPL. It'll tell you the name of the company that policy is under. It would tell you for us, obviously for privacy reasons, it's blanked out on this one, but it would list out the policy number, the policy holder, and the group number, and the type of coverage that it is, and the effective dates. And I think this is really important because sometimes like you're working with somebody who maybe they had coverage from their job from like a year ago, but maybe they no longer have that position anymore. Maybe that coverage is no longer active, but for some reason it's still showing up as active in MMIS. And maybe they're trying to go to the pharmacy to get prescriptions filled, and they're saying, no, we have to bill your primary insurance first. But so I know that's come up with as an issue before, both when I was an assistant, but also some of our community partners have brought that up. And so just a reminder that if you're seeing like if you're working with somebody and you're verifying this third-party coverage and they're saying, hey, this actually isn't active anymore, you would have to report that through the one system. So report that it's ended through the one system first. But also if it's like an urgent situation where maybe they're out of medications and they need to go to the pharmacy, you can also go to the reporttpl.org website and then fill in the information on there. So it's going to ask you for like their client ID, their previous policy information, which is all information that you could get from this screen. So the policy, the old policy number, the policy holder, the group number, all of that info. And then they'll get on it, and they'll they also have like a phone number where you can call in, especially if it's like an urgent need, and they'll verify it. And then usually within, if it's urgent, like I would say, call them in. And I know that I've had some assisters where like within an hour they had the HIG, which is the health insurance group, which is the who runs the TPL side of things, like they had already taken care of it. But it's also really helpful because maybe somebody does have active coverage, and they have an active third party coverage and they don't know that they had one, and then this is a good way for you to get them, back that information. So again, another really important part of the kind of information that you can see just from the view only access that you'll be able to have of MMIS.
I was going to say, and just along the lines there, Christina, like if you meet someone that is still on open card and it's been more than, the kind of 2-week enrollment period that it would for them to go to open card to a CCO, and they're still stuck on open card, a great thing to check is, do they have any old TPL attached to their account? Do they have any other health insurance? Because sometimes folks will be like, wait, I had that health plan, but it, canceled 4 years ago, but somehow the information never got to the health insurance group to fix it. So it's always a good tool just to come in and double check that. If you don't see any TPL, it could be something else, but that's a great indicator on what might be holding up their CCO enrollment. So just want to go along with that. Okay.
Yes. The other thing that you'll see is right under that section, you'll see something that says managed care / primary care home. And so managed care just refers to the CCO. So, right. So our CCOs are coordinated care organizations, or our managed care organizations. That's how we handle things here in Oregon for our Oregon Health Plan members. So it will list you, like, for example, in this example, it says Health Share of Oregon. And I do think if you live in an area where there's only one CCO, because I think health share is kind of its own little, they do things a little bit different than the rest of the CCOs. So if you were, say, like in Southern Oregon, it would just say Jackson Care Connect. Or if you were in Lynn County, it would just say Intercommunity Health Network, their phone number. It tells you a plan type. We're going to talk a little bit, we'll go over what the plan type means in a little bit. But it also tells you like the date that they were, the effective date that they were enrolled into that CCO, and then the date, again, normally it'll say today's date as the end date. But so it will also here, I think something that's also really important to know is that if that person is assigned to like a federally qualified health center as their primary care home, so sometimes you might see that show up on here. So for example, maybe it might say Virginia Garcia Medical Center, or it might say, Community Health Centers of Lynn and Benton counties, or whatever other federally qualified health center or rural health centers in your area. And I know that when I've worked with providers who maybe don't necessarily have somebody on staff that is super knowledgeable about OHP, they think, oh, that person's enrolled into, Virginia Garcia CCO, and it's not a CCO, right? That's just their primary care home that the person is assigned to. So that's just the primary care office that they see. And so, so I think that's something that's just, I wanted to bring that to your awareness that if it, and if it is one of the ways that you can tell if it is a primary care clinic versus the CCO is it'll say APM next to plan type. It says APM, which stands for, I think, alternative payment methodology. And so, so just wanted to make you aware, if it doesn't say CCO A, B, or A, G, I think there's a couple of, we'll see them on the next screen. Then it's not the CCO. But I also did want to say for the people that are in the Portland metro area, for health share, it's not going to show you which health share plan they're assigned to. So it's not going to show you like, oh, is this person under Care Oregon or are they under Providence? It's only going to show you like the main CCO, which in this case would be, health share. And
coming in.
Okay.
Yeah, Christine was just asking, do we know why it doesn't show the primary care provider all the time?
No, I think it's just because that usually gets handled on the CCO's end. Like the CCOs are usually the ones that assign the primary care provider. And so then that information doesn't have a way to get back to MMIS, right? Because that gets handled on the CCO end. So there's not like that communication back to us.
Yeah. That's what I was thinking, especially when we're, when folks are working with like CCO systems and they're like, gosh, this still shows their their out of date address. It's oftentimes because the one system hasn't shared the information with MMIS yet, and MMIS hasn't sent that information to the CCO. So it's always unilateral the way information is shared, unfortunately. So my dream is in the future that we have all of that primary care home information available a little bit easier. So we're always advocating for it, but there's a lot of mechanisms that are in the way.
Yeah.
And then Kelsey followed up to you, which I think was helpful. She had a question about if we did help to remove a TPL, do we know how quickly it might show in MMIS? Is it like a same day, next day, or do we know what that timeline might be?
It's pretty quick. So like if somebody like say maybe because I've had it where I think when was it a few months ago a community partner reached out to me and they needed to get it like urgently removed for somebody because it was causing an access to care issue, and it was a plan that had ended like last year or something like that, and it was like a few months old. So in the time that it took me to like she had already left a voicemail for the health insurance group, and then maybe like 20 minutes in the time that it took me, like by the time she was like, hey, can you help expedite this? By the time I logged into MMIS to see like, oh, okay, what's the issue? What's causing it? The health insurance group had already taken care of it. And I was like, I'm not seeing it. I'm like, what is she seeing? So I was like trying to get screenshots from her to try to figure out what was going on. And the health insurance group had already taken care of it. So if it's an urgent need, I would for sure give them a phone call because it's pretty quick.
Yeah.
Like as long as they can verify it, like they can go in there and update it within a few minutes. Yeah, they take care of it.
And Kelsey sent a message too, just for us to double check too. It's like these timelines can vary, so sometimes they can take quite a while. So I think depending on how you've submitted that TPL removal, like if you do it through the one applicant portal only, it's going to take a little while for it to get through that level of cases that probably the HIG is dealing with. So I would suggest, like we're saying, care, issues of access to care, anywhere where we're experiencing barriers, people have urgent care needs, just make sure that we're explicit with those requests so that the HIG can help to prioritize if there's someone that's experiencing barriers to accessing care. So just for you guys to recognize, similar to our applications we submit, there are going to be different timelines depending on the urgency. And just so that you guys know, like there are two people within the health insurance group that does this work for the entire
everybody.
They are amazing, and I just so thank them whenever they help you with this stuff, especially with expedited, because they are poor guys are backlogged constantly because there's not enough staffing. So it's good to have perspective, I think.
Yes.
Okay, let me go ahead and move on.
So this is where I mentioned that you would see the CCO's name, and then you would see a plan type. This is what those plan type means. So if it's CCO A, it means that the CCO is coordinating everything. So the physical, the dental, the behavioral health part. If it's CCO B, it means that the CCO is only doing the physical and behavioral health part, and maybe the rest of the stuff is on open card. If it's a CCOE, it means that the CCO is just coordinating the behavioral health piece, and then everything else is under open card. If it's CCOF, that means that the CCO is only doing the dental part of that. So that might mean that the person, so you'd have to go back and remember, we talked about if it would say DEN or DNT, then it might be that the person has one of those veteran, like the dental only benefits, so such as the Veterans Dental or the COPA Dental program. But it could also be maybe that somebody, like if it says BMH, that we know that somebody has full Oregon Health Plan benefits at that point. So then we would see like, okay, they're enrolled in a CCOF, then that means that the CCO is just coordinating the dental care part of things, and then everything else is under open card. So the behavioral health, the physical health is under open card. And then CCOG means that the CCO is just coordinating the behavioral and dental portion, and then the physical would be under open card. So and this is also in that little cheat sheet that we will send out to you all so that you can, I would say when I was an assistant, I used to have this like printed and like on a little corkboard that I had that was like right above my computer because I would forget, and I'm like, okay, what does this mean again? So I suggest maybe doing that also with the little cheat sheet that we email out to you all.
It's a lot of, I'll be honest, it's a lot of codes that don't make a whole lot of sense unless you connect to that association and do it constantly. So yeah, I definitely agree with Christine on that, because I'm constantly like, oh, what does that mean again? Shoot. All right, so our next section we were going to dive into, in case there's any other questions. Oh, so you could keep your CCO, but request that mental health is only on open card or goes to open card.
Yeah, so there's don't want to get too much into it because I think that could be a whole other training on its own. But yeah, there is a way, like if you're working with somebody who maybe because of continuity of care issues, like maybe they're having a hard time accessing behavioral health services or mental health services through their CCO's plan network, and maybe they had already been established with us, like with a different provider that wasn't within the CCO's network, but they took open card. You could submit a request, but that doesn't typically go through like an assister. It would have to go through their primary care provider's office or like maybe the mental health provider's office to coordinate that, because the person has to call their CCO. They have to try to work with their CCO to see if the CCO can meet the needs within their own network. And then if they can't, then they have to call client services unit. So it's a whole thing, but we do have a guide on group site that talks about, like, I think it's called a continuity of care exemption or something like that. So if you look on group site, we do have a little guide that talks about how, like, what steps would need to be followed. But yes, you could theoretically be on open card for just some of the benefits. And
I was gonna say some of them are definitely rare to see, so I didn't mean to go back. But yes, that can happen. Yeah. Great, thank you. That was probably, like, I think the smoothest way to explain that. Okay. I feel like that question's come up before and I've been like, hey, how do I describe?
I know, like, my goodness, how long do I have? No. And we can go, yeah. So the last slide, so I think that's really probably like the key things that are really valuable information that you'll be able to see, but we also wanted to talk to you about some, like, maybe some troubleshooting that you can have, because, like, just like all of our systems, every once in a while something goes wrong. Like, I wish they were perfect all of the time, but we also recognize that technology sometimes fails us. So here, the next couple of sections, or the next few slides, we'll just be talking about what to do if that happens. So if we go on to the next one. So if you have a hard time, so I think this is an animated one, or it should be, if we go on to the next one, it should have us. So if you have issues logging in, because sometimes you'll go click on the website, this used to happen all the time. Sometimes I'll go to the website and it doesn't even give me the option to, like, log in. Sometimes you have to go and hover over where it says account. You'll have to click on where it says log off, and then it'll tell, and then it'll give you this screen, and then you click on login, and then it'll display it again. So just FYI, if that happens, you can just click on that log off. I'm not sure why it does that, but sometimes it just does this, even if you hadn't been logged into it for a while.
I think it, for whatever reason, doesn't recognize the session has ended, and so it kind of keeps you residually logged in, but you still can't do anything. You still have to log out and log back in. So it's a little odd. So
yeah. So the next thing, other issues that come up if we go to the next slide, is that password reset. So if you enter, or if you forget your password, or if you enter your password wrong, only try it, because you only have 3 attempts to log in before it just locks you out. And if it locks you out, then you have to call or email, and then you have to ask you all of these security questions, and then to verify your identity. And so if you accidentally enter it wrong the first time, only try one more time. And if you're not able to do that, then just click on where it says reset password, and then it's going to ask you for your security questions, and then it'll allow you give you the opportunity to enter a new password and then submit, and then you have a new password now. But if you were to do it 3 times, again, it just locks you out. And then if you're working with a client, and sometimes that's just not super efficient, because then you have to wait and you have to call the provider services unit to try to get unlocked. They're usually pretty quick to answer, but again, I think to save you some time, it's probably just easier to not attempt the 3rd time. And I've personally locked myself out of it numerous times, and then they're always really nice, but again, sometimes I'm, like, in a hurry and I'm like, I really need this, like, right now. So anyways, maybe only try twice, and then on the don't try the 3rd attempt. Just reset your password. If we go to the next slide, so this is if you do lock yourself out accidentally, you can call the provider services unit, which is this number on your screen, or you can email team.provider-access at odhsoha.oregon.gov. And so they are typically, because again, this is the first time that people that are not like healthcare providers are having access to MMIS, or like people who don't work for a provider organization are getting access to MMIS. So they are very used to asking you for like your name, your username, and your provider number. And we know that not all of you have a provider, like a national provider identifier number or an NPI. So what they will ask you for though is typically your name, your username, and then they might ask you for your social security number or your ITIN, or just another, like maybe your address. So anything else just to verify that you, because again, you have so much access to basically our entire Medicaid population on this database, we have to be super careful. So, so just be ready that they might ask you for some additional information that beyond your assister ID number to verify that you are you before they unlock your account.
There are a couple questions that have popped up, but I think we'll save them for the Q&A.
Okay. The other questions is so just the best browsers that you're going to be using is going to, oh no, yeah, go for it. You're right. So the browsers that you're going to be using, really works best on Microsoft Edge or Firefox. Sometimes sometimes it doesn't like Google Chrome or some of the other browsers. So I would say if you're struggling using your regular browser, maybe try using Edge or Firefox. And then the other thing is that something that, as you were getting access to your accounts, for those of you who went through our process to get access to MMIS, you received 2 letters. One of them was like a PIN letter, and then another one was a provider. I forget, but there was like 2 letters that got sent to you.
Welcome letter, I think.
Welcome letter.
Email.
Yeah, so save those, because one of those letters has something called an Oregon Medicaid provider number. And sometimes that you might get asked, like if you lock yourself out and you need to call the provider services unit to unlock your account, they'll ask for that number. And that's the only part that you can find it. I think we can technically view it, like your rocks can technically help you find it as well. But I would just say save those 2 letters, because again, it has that number on there. But also, if MMIS were ever to go down, there is a phone, I think it's like a phone thing that you can access, so you can check eligibility for somebody, and the instructions to do that are also on those letters. Yeah.
I'm pretty sure the provider ID one is on the welcome letter that you guys would have been emailed by Shantae. So if you did happen to misplace it, it should have been emailed to you. And if you do have any hard times finding that, let us know. But again, yeah, it's just helpful to have those recorded and saved. Let's see. And then that last one too, Christina, is how often do provider portal passwords expire? And it is every 90 days. So you guys will be requested to do the password updates. In Christina, was there maybe we don't, I'm not sure if we covered it in here, but if you don't log in for quite a while, does that have any effects or issues if you're not logging in consistently, or at least like once a month?
Yeah, I think something does happen, and I'm trying to remember what it was, but one of them is I think it locks out your account as well, and then you'd have to call in to get it reset. But I think that's also something really important, is that do be logging in. Try to log in, and I think as you get familiar with it, like I used to, when I was an assister, I used to log into MMIS more often than I did to the one system, because I used information from MMIS more frequently than I did from the one system. So yeah, that was like usually the one screen that I almost always had pulled up. But yeah, the passwords do expire every 90 days. This is just a reminder of like, if you see incorrect or mismatching information on MMIS, so like the TPL thing, this is what we talked about. So reporting it through the TPL.org and then calling the phone number, especially if it's an urgent need. But also every once in a while, you'll see an incorrect name or date of birth that's displayed on MMIS. And sometimes that can also cause like an access to care issue for people as they're trying to access benefits, because maybe it's not matching what the provider's office has on file for their date of birth, or and maybe the information on MMIS is just, it's just not accurate. So just from like for those kinds of situations, you would need to call in the the community partner access line and let them know that, hey, this information is showing up incorrectly on MMIS, and so then work through the same routes that you would normally take to help resolve that issue. Or also, you all might. Oh, sorry, I'm gonna. Yeah, did you need to add something?
Yeah, the only was that as like we had this come up a couple of times where folks would look into MMIS and a name would be spelled wrong. It is not usually not an issue with MMIS. It's an issue with the One Applicant Portal or how the information was entered. So a lot of the confusion we've been seeing recently is that there is the legal name and preferred name. So if you guys put in a different preferred name, or say you misspell the legal name and correctly spell the preferred name, you guys will only see the preferred name when you log into the One Applicant Portal. But if you happen to look at MIS and you see a misspelled name, that means that there might be something wrong with the legal name within the One Applicant Portal, and you may need to send in a correction that way. So I've just for folks, in case you do see that, that's the kind of walkthrough that we found was the issue going on. Sometimes it's hard for us to kind of troubleshoot that. So that's a little thing I want to add.
The other thing is that sometimes like as you're trying to find somebody, you might see that somebody has like more than one client ID listed, and that sometimes that happens. I think I used to see it happening for people that maybe didn't have a social security number, because maybe the system thought that somebody, like, they didn't realize that they had already applied, and then they came to somebody else and then they applied again, and every once in a while they'll have like a duplicate case with a duplicate client ID. So that means that there's like two separate OHP benefits going on for the same person. So if you notice stuff like that, please call the community partner access line and let them know that that's happening, and then an eligibility worker will have to go in and they have to merge those two cases, and then they'll usually let you know right there and on the phone like which of the two IDs they'll keep active, but just letting you know that sometimes that does happen, and if you see that, please work with the CP line to get that resolved. Some other tools and resources for you. So we have this MMIS eligibility guide screen. So this is that cheat sheet document that I was telling you about, that has a list of all of these codes that we just talked about. And then we also have a hyperlink to the website. So the MMIS website. There's also hyperlinks there's a really good FAQ document that talks about like some of those things, the troubleshooting things that we just talked about. So like how to reset your account, or like what happens if in this scenario, or like what happens if the MMIS screen like portal is down, how do we verify? So it has some really helpful information on there. And then I think both of those have the troubleshooting document too.
And I think that is it. We're at this point just at questions. Thank you, Christina, for taking a good chunk of that training. I appreciate you answering all those questions. I know we answered a bunch kind of along the way, and it'll right at noon. We are like right on time for our hour, but I'm sure Christina might be willing to hang around for a couple more minutes to help answer any extra questions folks might have. I know Shintran did ask a question through the Q&A, so I appreciate you using that, Shintran, as well, but I missed it earlier, so I apologize. I was excited about getting access to MMIS because she believed that we could see the dental plan that people are enrolled in. And I know that doesn't quite show up, correct?
No, it'll only show if somebody has somebody that maybe had open card, and maybe because I don't think it used to show like if somebody had open card for benefits and then they had like a dental care organization assigned, it used to show up on there. But this year we went away from like the state directly contracting with the dental care organization, so I don't think it shows up again.
We went from like direct DCU contracts to the CCOF, right?
Yeah.
Yeah. Okay. So you would, Shintran, I would still recommend again, and this is where I've always like struggle a little bit, because I feel like when we get you guys new tools, it's like you get 99% of the way and then it still doesn't quite have everything. So I'd always say, use MMIS to double check, especially if you're in an area that has 2 CCOs. Use MMIS to find out what CCO they're enrolled in, and then you'd want to reach out to the CCO directly to find out both like health plans and dental plans. So
yeah, but it should be listed on their card. Like on their insurance card, it's usually listed on there, like it says DCO or like dental care provider, and it has the phone number on there. So, so I would say check that out as well. And nice to see you, Chantrine. Oh, when they don't have cards, yeah.
That's a it's a major issue, Christina, in our area. I know,
especially with health share.
It takes 3 to 4 weeks. So they're almost a month and a half into care before they get their ID cards. So Chantrine, another helpful thing, and I apologize, Chantrine, are you in the metro region? I'm just
no, Southern Oregon, Jackson County.
Oregon. No worries. Okay, well, I would double check to see if they have an online option to, Christina, do you know if your CCOs have an online option to do a virtual ID card?
I'm trying to remember. It's Care Oregon. So Care Oregon does Jackson Care Connect. So do they have it? I'm trying to remember.
I don't know. I would check in just to see if they happen to have a way to do an online ID card. I know some of the ones in my area do, and that could be another quick way to get access to a card. Okay. Okay. Awesome. But yeah, it looks like Advanced Health does as well. So I would just check just in case you need access to that card quickly for the members one. And then Danielle, do you have a question you wanted to ask the group?
Yeah, so I asked it in the chat, but I don't know if I worded it correctly. So I got the letter that has my PIN on it, but it blurs out my provider number. So I'm not sure at what point.
Yeah,
I said that. I don't know what it is, I guess.
Yeah. So Danielle, you would have been emailed your PIN letter. It would have come from Shantae, I think it's Mullet. Yeah. So if you would have received an email from her, it'll have a welcome letter as well as your PIN letter.
Got it. Okay, so our provider ID would have been assigned by
It's assigned automatically during your enrollment, and then they mail you the PIN letter. And it's a lot like when you get a new credit card for like a bank, where they don't want to put too much information like a PIN letter and the credit card in the same envelope. So that's why they send it to separate locations in case the PIN letter were to be accessed. Someone wouldn't have access to both the PIN and the provider number at the same time.
Got it. Okay, that answers my question.
And if you can't find it, let me know, and I can make sure to send an email with her email just to help with searching. But I would just do a search in your email for MMIS, and it should pop up her email.
Yeah, I found it right now. Thank you.
Okay, fantastic. Great. Okay. All right, guys. Any last questions? I don't want to keep folks too much longer. We'll have this recording available for folks as well as for future team members. Oh, looks like we have one.
So I would say, because somebody I wanted to say, can we check our own stuff? And I would say probably not. So it's just the same way that, like, if you were at a doctor's office. So when I used to work at a doctor's office, I wasn't actually allowed to go into my own medical record or my own stuff. So, but if you have like I would say if you're working with like another, maybe somebody in your organization, and they you gave them permission to check on your behalf, that's typically one of those like HIPAA stuff that we actually don't. So no, but I would maybe work with a colleague or somebody who can check on your behalf.
Just so that we make sure we keep those strong lines around access of information. It just can become a slippery slope really quickly, and we want to make sure that you guys are using it in the best way possible.
Somebody said, is that online or virtual card temporary or permanent?
T was just asking about the temporary cards that you can get from like the CCO websites. Those are, in, like Kelsey had mentioned, those are permanent cards. It wouldn't be like their open card version. It would be the one from the CCO.
Got it.
All right. Okay, guys, any last questions? Just give it another 30 seconds in case something pops up. Oh,
thank you.
I know it's always hard to lose a rock, especially an amazing one like Christina, but I think our person that's coming up is going to be amazing. So
Yes.
haven't switched in yet, but all right, guys. I don't see anything else. So thank you so much for everyone for joining, especially on a Monday morning after a weekend. So thanks for being here. I will get this recording available either on YouTube or on demand in our GoToWebinar. So it'll be available soon. And I'll send a follow-up to everyone. And thank you so much for taking the time, guys. And thank you, Christina and Kelsey, for helping support and making this happen. So thank you so much, guys. I'll go ahead. And if you want to pause the recording.
Yep.
Okay.
Bye-bye.